My name is Olga Rodgers. I'm a nurse practitioner student. And what is your name, sir?
My name is Fred Booker,
And what's your date of birth?
December 14th, 1964.
Who's the president?
Trump.
Okay, and what date and approximate time?
It's about the 30th, and it's about 7:30, 7:40
Okay, and where are you?
at the doctor's office.
Why are you here?
Physical.
Okay, do you have any other concerns or symptoms that we need to discuss today?
No, just a basic checkup.
Okay, so you came in today, your weight was 158 pounds, your height was 5'7", and that means that your body mass index is normal within the appropriate weight for your height, so that's good. Okay, so we'll go ahead and do an eye exam on you. Okay, so we'll have to stand over here. I have the Snellen eye chart here, but I need for you to stand over here. And sir, if you would cover your left eye for me. And if you could, with your glasses on, if you can read the smallest line and indicate which line number you can read, the smallest line.
Okay. I could do number 8.
Okay, could you read that line for me?
EDFCBF.
Okay, could you read number 7?
No.
This one right here?
No.
Number 6?
Yes, number 6.
Okay, let's see you read that one.
I think I can make that out. The other one.
Okay, let's see.
Okay. FELOPZD.
Right, so that indicates out of your right eye, you can read 25 feet away, what the average person could read 20 feet away. Okay, so let's cover up your other eye. Okay, so which line number can you read? Can you make out? The smallest line number?
7.
Okay, can you read that for me?
FELOPZD.
Okay, so that means out of your left eye, you can read 25 feet away, what the average person could read 20 feet away. So both eyes, 20, 25. Okay? Oh, you can come back and sit down. Okay. Thank you. So now I'll go ahead and do your vital signs. And if you can place this under your tongue for me. And hold that. You can hold that with you. 110 on 62, and that is within normal limits, your blood pressure. Okay. And I'm going to take your pulse, your radial pulse. Your temp is 96.4, which that's fine. Your rate is +2, so normal rate and rhythm. Okay, that's great, which is 62. Your pulse is 62, and your respirations are 14. Okay, which is normal. And that's your breathing. Okay, so now I'll go ahead and assess your head. What I can see so far, that your head is within normal size for your body, which we call normal cephalic. Okay, and the patient appears clean, no odors, well-spoken, content, what he speaks is appropriate. Okay, so now I'm going to assess your head. Okay, I'm looking for any lumps, bumps, open areas. Ever any problems with your head? Hair well distributed?
No.
Okay. Redness, Okay, I notice the hair is oily. It smells good, appears clean, well distributed, a little gray in the front. Okay. Okay, so now I'm going to look at the symmetry of your face. Your eyebrows, eyes, and folds are all symmetrical. Your nose and lips appear midline. So could you take your glasses off for me, sir? Okay, I'm going to check your maxillary sinuses. I'm going to put a little pressure right here. How does that feel?
Just a little pressure. I feel a little pressure.
Okay, that's normal. Any problems with your sinuses?
No.
Okay, and your frontal sinuses, any problems when I do that? Any pain?
No.
Okay, so you can get and put your glasses back on. I'm going to check your temporomandibular joint. Okay, can you open up your mouth? Okay, one more time. Okay, no crepitus, overlaps, feels like it overlaps pretty easy. No problems. Any problems with your jaw?
No.
Okay, okay. Okay, so I'm going to look at your nose. Your nose appears midline. Okay, I'm sorry, could you hold your glasses up for me, sir? Okay, so, okay, your nose appears midline. Okay, no deformity. Could you hold your one of your nostrils closed and breathe? Okay, and the other one? Any problems with that?
No.
Okay, so now I'm going to look at your septum. Could you hold your head up just a little bit? Okay, your septum is midline. Okay, inside your nostrils, they appear pink. No redness. Okay, hair well distributed, no lesions. Everything looks great. Okay, so now I'm going to look at your lips. Okay, your lips appear moist. Um, they're pink and brown according to your ethnicity. Okay, could you open your mouth for me? I'm going to look at your teeth. Okay, the teeth appear clean. Okay, no teeth missing. Okay, I see a cavity, left upper quad in the back, way in the back. Okay, could you stick your tongue out for me? Okay, tongue appears moist and rough and pink, which is normal. Okay, could you hold your tongue up for me? Okay, I'm looking under here definitely because many times this is where oral cancer can start. It's moist, pink, mucormycosis are moist and pink. Great. Okay, so when you stuck your tongue out for me, you just exhibited cranial nerve number 10. Okay, sorry, number 12. Okay, so can you open your mouth for me one more time? Okay, okay. Tonsils present, no redness. And back of the throat appear normal size. Can you say ah for me? Okay, uvula and sulcus moves up, so you just demonstrated cranial nerve number 9 and 10. Great. Okay, so now I am going to check your maxillary sinuses. Okay, no swelling your parotid sinuses. Okay, so I'm going to check your neck. Okay, your trachea appears midline. I'm palpating your thyroid gland. That appears normal. Okay, I'm going to palpate your carotid. +2, rate and rhythm normal. +2, rate and rhythm normal. Okay, so I'm going to check your lymph nodes. Okay, your preauricular, postauricular. Okay, your submental, submandibular. Okay, jugulogastric. Okay, your superficial cervical, your deep cervical line. Okay, your post-cervical, your occipital. Okay, and could you shrug your shoulders for me? You just demonstrated cranial nerve number 8. Could you keep them shrugged for me? I'm going to check the lymph nodes in there. Okay, your subclavicular. Okay, that's all normal. Okay, so I'm going to check your ears. Your ears look symmetrical. Okay. Outside, no open areas, no lesions, no cerumen on the outermost portion of your ears. Okay, everything looks fine. Any problems with your hearing?
No.
Okay, I'm going to whisper some words to you and I want you to repeat them back to me.
Snow White. Louisville Cardinals.
Great. Okay, so I'm going to check for bilateral hearing to see if you hear equally out of both ears. And this is a tuning fork, and this is going to allow me to do this. Do you hear both on both ears?
Yes.
Bilaterally equal? Okay, great. So that was called the Weber test. Let's check for bilateral hearing. Okay, so now I'm going to check for motion, range of motion to your neck. Could you look up, look down? Could you look down? Left, right. Okay, could ear to shoulder. The other side, ear to shoulder. Great. Okay, so now I am going to check your arms. Okay, could you hold out your arms? Just hold them up like that. Okay, so warm to touch. I notice you have look like some old burn marks here. What happened?
Hot water burn.
Oh, when was that?
When I was 13.
Any problems with this?
No.
Okay. No pain?
No.
Okay. So I'm going to check your hands. Okay. I'm going to check. Everything looks fine. I'm going to check both radial pulses. +2, regular rate and rhythm. Color looks normal. Okay. Okay, so I'm going to check for lymph nodes under the arm, lateral lymph nodes, deep center, pectoralis, subpectoralis, subclavicular. Okay, I'm going to do the same on the opposite side. Lateral, deep center, subpectoralis, subclavicular. Okay, everything looks fine with that. Okay, so now I want you to hold your arms out for me like this, and I want you to put your palms up, and I want you to hold it there for 10 seconds. Great. Okay, so I was looking for a pronator drift because if some people that have had a stroke or any kind of lesion or injury, some people may not hold up one side, may not be able to hold up one side. They may experience weakness. Okay, so can you grab both my hands? Squeeze. Not too tight. Okay, can you push? Okay. Any problems? Ever any problems with your hands, your arms, your elbows?
No.
Okay. Any problems doing this when you're moving up,
No.
back and down? Okay. What about this side?
No, no.
Okay. I don't feel any crepitus or anything like that. Okay, so could you hold your hands down like this? Out to the side? Up? Any problems?
No.
Okay. On your hips? Okay, can you make muscles with them on your hips? Okay, I don't see any lesions, open areas, anything like that. Okay, I'm looking at your chest, hair well distributed. I don't see any raised areas, indentations, or anything like that. Okay, so you can relax now. So I am going to check your lungs. I'm going to check your bronchial area first. Okay. And I want you to breathe normal for me, but breathe out of your mouth. Okay, could you stand up for me? I'm going to check your back, your lungs and your back. I'm looking towards your back right now. Okay, everything looks fine. No lesions, open areas. Scapulas look symmetrical. Okay. Okay, everything sounds clear. Okay, you can have a seat. Everything sounds clear, so I'll go ahead and check your heart now. Okay, your aorta. I'm listening for S1, S2. I'm listening for S3 or S4 if it's present. I'm listening for love dub. Anything abnormal. Mitral valve prolapse or, okay, the pulmonic area. Tricuspid area. Mitral. Apical. Okay, if you can lay back for me. Okay, now I am looking for jugular vein distension. Could you turn your head to that way for me? Okay, I'm looking at the jugular vein. Okay, it looks nice and flat like it's supposed to. Can you turn your head the other way? Okay, it looks nice, flat, no bulging. Okay, now I'm going to check your abdomen. Okay, so your abdomen. Okay, I'm looking at the contour. It's round, but it's soft. Any problems with the abdomen? Ever have any pain? Any pain with constipation or anything like that? Diarrhea? Okay. So now I'm going to look for symmetry. So I'm going to have to go to the foot of the bed. Okay. Everything looks symmetrical. And I'm looking for your breathing. Your breathing is normal, a normal rate. And I'm looking to see if I see your apical pulse, which I don't see your apex beating. Okay, so I'll listen to your bowel sounds. Okay, your bowel sounds are positive, no hyperactivity or hypoactivity. And I'm just going to do some light palpation. You just let me know if you feel any pain. Okay?
No pain, just pressure.
No nodules. I don't feel any abnormalities. Okay. I'm going to palpate your kidneys. Any pain right there?
No.
Okay, you can lay flat. Yeah, you can stay flat. Okay, I don't feel any abnormalities, any swelling, any problems with urination or incontinence or anything with your bladder?
No.
Problems holding your urine? Okay, so everything looks fine with that. Now I'll go ahead and check your aorta. and your renal arteries. Okay, that's fine. So go ahead and look at your legs now. Okay, I see you got some varicose veins at the top of your leg. Have you had those for a long time? Spider veins, really.
Pretty much, yeah. I had them all my life.
You did? Spider veins?
It's probably just because of my color of my skin.
Oh, okay. Okay, so I'm checking the temperature. Your feet feel a little cold. Are they always a little cold?
No, it's the temperature of the room.
Oh, okay. So I'm looking at this black mole right here. Have you always had that?
Yeah, it's a birthmark.
Has it always been there? Has it ever changed in
No.
size? Okay, so I'm going to look underneath, because a lot of times the varicose veins will be at the back of the legs. Thank you. Okay, no. So I'm going to check your pedal pulses. Pedal pulses are +2, regular rate, and rhythm. I'm going to check for capillary refill. Which are less than 2 seconds. Which are less than 2 seconds. Okay, so I'm going to go like this. Can you push up against me? Okay. Push up against there. Okay. I'm going to raise your knees up. Any problems with that?
No.
Okay. Any problems with that?
No.
Okay. Can you spread that leg out? Okay. Now can you spread the other one? No problems?
No problem.
Okay. So I'm going to raise this up and bring this in a little bit. Touch me. Any problems with that?
No.
Okay. So you can stand up now. Okay, so I want you to close your eyes. Okay. Any problems with that?
No.
Any dizziness or anything?
No.
Okay. Okay, so now I am going to ask you to touch your nose with your finger. Now, can you touch your nose with your finger and then touch my finger and repeatedly repeat it? Keep repeating it as fast as you can. Okay. Very good. Okay. So now I want to see you walk across this area right here. I see a normal gait. And you have any problems with your walking at any time?
No.
Okay, so could you bend over and touch your toes? Okay. Now, can you take your left foot and slide it down your right shin? Okay, the other foot. Okay, I'm checking your balance, and that looks pretty good. Okay, can you turn around for me? Okay, I'm looking at your spine. Okay, it's symmetrical. It's a straight line. Okay, I don't see any problems, any bulges, any pain with your spine. You ever have any problems with your discs or lifting or anything like that? Okay, can you bend forward and just hold on right there? Okay. Okay, can you bend down just a little bit more now? Okay. Okay, normal curvature of the spine. Okay, everything looks great. Okay, sir, we have just completed our annual assessment.
Thank you. Have a good one.